Hello, everyone. Thank you for inviting me to be here today. I'm going to be talking about using telehealth to empower primary care providers in the treatment of hepatitis C in the Cherokee Nation. So in 2011, I was hired by the Cherokee Nation as an infectious disease specialist, and one of my jobs was to treat hepatitis C. When I got there, we evaluated that we had 263 patients that needed treatment, but looking at seropositivity rates, we estimated that we had over 1,800 patients who needed to be diagnosed and treated. And I was the only hepatitis C provider, and there were 9 different clinics throughout the Cherokee Nation. On the left-hand side, you can see the map of the Cherokee Nation. It's in northeastern Oklahoma. The little star is where the hospital is, and the red crosses are where the outlying clinics are. And this is not a problem unique to Cherokee Nation. It's a nationwide problem. And as you can see on the top left, the CDC reported that acute hepatitis C disproportionately affects Native Americans, and also the mortality is much higher compared to other ethnic groups. So how to solve this problem? I ran into this article in New England Journal of Medicine published by Dr. Aurora from the University of New Mexico, and in which he used a telehealth platform to treat patients with hepatitis C. So there are patients that need treatment. There's not enough specialists. So using this program, which develops a hub, which consists of hepatitis C specialists that connect with the spokes or the primary care providers and train them on weekly sessions on how to treat patients. Basically, the providers present the cases to the specialist, and the patients get the right care in the right place at the right time. So this is what we did in Cherokee Nation. If you look at the map on the right, we started with one clinic in Tahlequah, where the hospital is, and after the training with this telehealth program, we were able to cover the whole geographic region of the Cherokee Nation Health Services. And we, as I mentioned, we trained 15 primary care providers and 8 pharmacists, and we were able to treat almost 1,000 patients. 764 were cured, and we prevented many patients from developing hepatitis C complications, such as cirrhosis, liver cancer, and extrahepatic manifestations. And we went a bit further and also trained these providers on harm reduction, because many of these patients with hepatitis C have substance use disorders that need medication-assisted therapy. So if you look in the graph on the left, on the x-axis is the number of patients treated for hepatitis C every trimester. The line is the cumulative number of cases treated. As you can see, when I was the only specialist, very few patients were treated. By mid-2019, almost 1,000 patients had been treated. And when you look at the graph on the right, we can see that the outcomes were very similar when nurse practitioners, physicians treated the patients compared to a specialist. Actually, percentages are higher for the nurse practitioners and physicians, 98%, and there are only 92% for physicians. I'm sorry, for specialists, but this was not statistically significant, and this was regardless if they had cirrhosis or not. Due to the success of this program, we expanded Project ECHO, not only for hepatitis C, but we started including patients, training our providers in managing HIV PrEP, general infectious diseases, and substance use disorders. And I just wanted to share this experience with you because it could be useful if you're not already doing it. And I would be delighted to answer any questions that you may have. Thank you very much for your attention.